Welcome to Longevity Post.
With Bob and Brian.
So Brian, who might I be?
You are Bob, health analyst at longevitypost.com and my irreplaceable sidekick. And who am I, Bob?
You are Brian Simonis, Chief Researcher at Ortho Nutrition and also an orthomolecular practitioner.
Erectile dysfunction. What to do about it, how to fix it.
So Brian, why is erectile dysfunction so common nowadays?
Well, Bob, it seems that there are a lot of diseases happening. We're talking about diabetes, cardiovascular diseases, incredible rates. And this is causing what's called endothelial dysfunction, which is the lining of the blood vessel deteriorating and reducing the action of a short-term chemical gas, which allows the blood flow to stay in the right places downstairs. But that's not the only cause, Bob. There's lots of others.
Would you care to mention a few?
Sure. One thing I think that's important to recognize is that 90% of this stuff can be in part psychological, but my opinion is that physical could also cause a psychological problem. So if things aren't working very well psychologically, it's also going to be impaired. So I think it's really a combination of two things. Maybe the physical goes wrong first, and then psychologically, if you think things aren't working, then that's going to also wreak havoc. So let's get strictly into the physical. So I think the first thing to mention is that some people might be taking medications that could be causing problems. Some of them could be antidepressants, SSRIs, serotonin reuptake inhibitors. They could be statin drugs. They could be oral contraceptives. They could be any drug, which all drugs pretty much offset the way your body works, the way it's supposed to work. What do drugs do? Well, they block enzymes or they block physical pathways. A lot of times this sort of makes things not work correctly. So that's one thing you might want to look at. If things aren't working downstairs, is it something I'm taking? Of course, a lot of people resort to certain drugs like Levitra, Cialis, or Viagra to address their problems, but there are risks. And wouldn't you like to get to the crux of the problem, what's really actually happening inside? So I guess the question is, what do we do about this? And I mentioned that things like heart disease, diabetes are very prevalent today, more so than ever. And there's a lot of reasons for that. And so I guess it'd be kind of good to know, why aren't things not working correctly? What steps can we do to fix this? So let's start with number one. After you figure out it's not the drug that's causing the problem, then you want to turn next to, are you getting enough vitamin D? If you're not getting a lot of sunshine, then you might supplement with vitamin D. And if you supplement with vitamin D, that's going to actually raise your steroid hormones over a period of time. And this goes far beyond just simple steroid hormones. This goes beyond a lot of things.
Besides vitamin D, what other supplements are going to optimize erectile function?
If someone wants to replace the big three, Levitra, Cialis, or Viagra, they want to do it naturally. What I recommend for myself, for example, if I had a problem like this, is I would take 300 milligrams of grapeseed extract, and I'd want to pair it with an amino acid called arginine pyroglutamate. Arginine pyroglutamate is probably the most effective form of arginine available. The only problem, Bob, is that arginine pyroglutamate is not easy to find. If you can't find that, you might want to look for something called arginine ketoglutarate, which is not quite as effective, but better than plain L-arginine. The problem with taking any arginine, though, is it's not going to work effectively unless you take grapeseed extract. Because the grapeseed extract, what that does is it allows the arginine to produce the short-term chemical gas nitric oxide, not just for a small bit of time, but a long time. And not long enough so that the blood's going to stay in the right places for long enough so that you can get the job done correctly.
And this is, of course, taken daily.
Yes. In fact, Bob, the longer you take it, the better it's going to work. In fact, in a research study back in, quite a long time ago, I can't give the exact figures, but research done, let's say quite a long time ago, showed that when the participants took it for about 3 months, the efficacy rate was very close to 100%. Not exactly 100%, but we're talking close to 95%. So the effects, the overall positive effects were nearly 100%. So that's pretty spectacular.
Yeah, so the users needs to be patient with this. They need to allow time to work to their benefits.
Yes, absolutely. Now, it's very likely you might get a response immediately. You might notice something the first day. I would almost bet money on it. But everyone, of course, has a different derangement of endothelial dysfunction. In fact, endothelial dysfunction, which is the inner lining of the artery, that damage could be moderate to severe, maybe mild. Or the problem might not even lie in the endothelial lining. It might be another area, so we're going to get into that as well. What else could be causing the ED or erectile dysfunction? So, any questions on the erectile dysfunction in the area of the grapeseed extract and the L-arginine? Maybe I should address how much arginine should be taken.
Yeah, please do that.
So the amount of that I would recommend, say for myself, if I had such a problem, is I'd want to start perhaps with 2 grams of the arginine pyroglutamate. If I can't find the arginine pyroglutamate, I want to look for arginine ketoglutarate. Perhaps take 1 or 2 grams of that, with about 300 milligrams of the grapeseed extract. And you could do this once or twice a day, depending on your sexual activity.
But they should always be taken together.
Yes, should always be taken together, correct. They work synergistically together.
And how do you incorporate vitamin D, as we talked about earlier?
That's a fantastic question, Bob. I'm glad you mentioned that. I recommend for most people, because they do live in different areas of the world. If it's in the southern hemisphere, I would suggest maybe 5,000 international units per day, unless you're outside surfing every single day. On the other hand, if you're living in the northern hemisphere, and it's going to be a little bit more variable, or if you're living right on the equator, it's going to be a little bit more variable. So you might want to have your vitamin D levels tested, but generally somewhere between 5,000 international units and 10,000 international units is generally going to be safe and well received. It really depends on the frequency that you're outdoors and exposed to the sun, during the time, especially in the summertime. During the winter time in the northern hemisphere, there are some regions that produce no vitamin D producing rays whatsoever, and vitamin D supplementation will be essential.
And do you suggest that this should be taken with the 2 other products, or could one take it whenever during the day? Should it be taken with fat, since it's a fat-soluble vitamin, or what is your recommendation?
That's also a fantastic point, Bob, is yes, it should be taken with a fat-soluble substance. In fact, vitamin D is shown to simply absorb better with fat. It is basically a lipid-soluble hormone supplement. So yes, absolutely. It's going to be more effective that way.
Okay, great. Yeah. You mentioned before that there could be more reasons for this than just, damages inside of the penis. Can you elaborate on that one?
Yes. In fact, I should speak to the fact that it's not just really the organ itself. It's really your entire vascular system that's affected. So the short-term chemical gas travels through your arteries and your vascular system, the veins and the arteries. And if your veins or arteries are firm or hardened or inflexible, they're not relaxed, the short-term chemical gas known as nitric oxide is going to relax them and allow them to be more pliable and also fill with blood. On the other hand, if they're hard or stiff, they're not going to allow the blood flow. And it's simply going to be very, very difficult to maintain a firm situation downstairs. So what else could be causing erectile dysfunction? And this is an important thing. If for some reason the grapeseed extract and the arginine products do not work correctly, it could be that you are producing a elevated level of prolactin. Prolactin is a hormone that most people associate with nursing mothers, and it's actually a substance that usually is secreted after ejaculation. And this is actually a substance that makes you generally feel like you don't want to do anything. Also, it downregulates a happy hormone called dopamine. If you don't have enough dopamine, it means that you might have too much prolactin. So one thing you might want to do is you want to raise your excitement, your motivational hormone, which is dopamine. And to do that, you want to down-regulate the prolactin. And by doing so, you're going to have more of a powerful overall body stimulus to want to just sort of have things rocking, in the bedroom. So some people will take a supplement, very inexpensive, called chasteberry. Chasteberry is also known as Saint Vitex. It's also known as Saint Vitex Angus. However you find it, the dosage is important. And I should say that you want to take at least 400 milligrams of chasteberry. Some people could take it 3 times a day. Some people might even take it more than that. But generally, 1 or 3 times per day is sufficient. In fact, if you were to take it sometime before you're doing intercourse, it's probably not a bad idea. In fact, some people find that clears their skin up, which is a nice benefit.
When you say 1 to 3 times, you mean it's up to 1.2 grams a day?
Yes. In fact, some people, it's relatively harmless. You could take even more of it. I think for the sake of convenience, if you're really, really concerned about it, you might take it 3 times a day, or just experiment and see how your body responds to it. If you're not really into taking too many pills, you might just try taking 1 sometime before you're doing stuff in the bedroom. And what that's going to do is it's going to increase dopamine, and it's going to downregulate the prolactin. And if you respond to this, it might make things very effective.
Yeah, okay, I see. But could people who are, worried about prolactin, could they do any kind of blood testing or find out where they are?
Well, that's an excellent question, and I'm about to confuse you. At least the audience here, is prolactin is a really controversial subject because some of the research suggests that too much prolactin is a problem, and other times research says the exact opposite. So it's really more of a point of how does it affect you? In fact, here's another part that gets a little bit more interesting. When you take an arginine product, arginine actually increases prolactin. So that's another conundrum. So you really want to experiment and find out what's working for you. So I wouldn't pay too much attention to what your prolactin level is. I can tell you that if you do a test for prolactin, if it's very elevated, it could suggest you have a hypothyroid condition. But not always. It could mean a lot of different things. But I think it's simple, more to the point, to experiment and find out how the chasteberry or St. Angus Vitex, or St. Vitex for short, how that affects you. It's much more simple, straight to the point. And, you'll know very quickly how effective it is for you.
Going deeper into this, are there any other products you want to mention?
There are actually lots of products out there. And so keeping it as simple as I can, these are probably the most basic fundamental things one can do. But if you want to explore further, there are ways to improve your function even further. And this is a very good question, Bob. So I'm going to mention step number 4. There was a study back in 2004 that demonstrated that if you improve or boost acetylcholine to the brain, you can do something that's more effective than testosterone, which is pretty amazing if you think about it. There was a supplement they took, which was 2 different forms of carnitine. And I'm going to make this really simple. I'm not going to get too in-depth into the study. I'm just going to tell you something that simply works. If you take something called acetyl L-carnitine in the amount of 4 grams, and this could be taken in divided dosages, so I would suggest taking perhaps 2 grams sometime in the day and then another 2 grams later in the day, you can massively boost acetylcholine to the brain. And what this is going to do effectively is to improve your not just your libido, but your ability to maintain erection more powerfully than, say, someone who had a testosterone treatment. If you want to augment this process even further, which I do recommend, you want to take something called alpha-lipoic acid. What alpha-lipoic acid does is that it actually augments the effects of acetyl L-carnitine. It does this in 2 ways. One is that it helps blunt or fight any free radicals generated from acetyl L-carnitine. It also improves the endothelial function, and it also enhances the permeability through the blood-brain barrier of the acetylcholine. In fact, it does much more than that, but within the scope of this, I will just mention the dosages. So we're going to go at 2 grams of acetyl L-carnitine and then an additional 2 grams of acetyl L-carnitine. Every time you take 2 grams of acetyl L-carnitine, you're going to want to take about 300 milligrams of alpha-lipoic acid. So you do that, your overall function, not just in the brain, but also on a physical level, the endothelial function is going to be massively enhanced. So I think that's really, that's the issue in a nutshell. If you're eager to get healthier, but are fed up with non-holistic, pharmaceutical-based, one-size-fits-all approach, simply subscribe to our channel and let's prioritize longevity together. Free of charge, full of longevity.
Also, you can help us out a lot by pressing the like button for this video. Thanks and have a great now.